In this video, I'm going to go over a scenario of a hospitalist providing ongoing care to a pneumonia patient. We're going to review current blood work, order some new updated blood work, a chest x-ray, and document a progress note. So when we do log into Web Expanse, into the Web Acute, we're on our rounds list, which is what we're on here. We can toggle our patient, selecting our patient green or not. So from here on our patient, we've got our last name, the floor they're on, admitting diagnosis, MRP, age, and sex. And to the far right, we have a quick launch for lab work. So in this case, there are some urgent labs that do require our attention. There's new imaging available and a note that's been updated by perhaps another provider. So I'm going to click on this quick launch icon, and that launches our quick panel here. So we can tell we've got some unhappy results from our microbiology department. So we're going to read that. And as suspected, the patient has got strep pneumoniae growing. So the diagnosis of pneumonia absolutely confirmed. We've got our recent blood work here. White cells are quite high, metabolic panels, and blood gases from earlier. So in this case, now that we've reviewed those new results, I'm going to show you an example of ordering them. So we do want to make sure our patient is highlighted. So again, you can toggle from green to white. So green is what we want to highlight that we're choosing this patient, and now we can go into ordering. So let's say we wanted to repeat some of this blood work. So let's say we wanted to do a CBC. So that's routine. We wanted to do lights. Routine. I'm going to show you an example of doing a blood gas. I'll type in ABG. So we can do it, we can choose if it's urgent or routine. So in this case, I'm going to call it routine, but it is still red and highlighted red, and that's because there's a mandatory field that we do need to fill in. So it's asking us for our O2 level. Do you want a room air blood gas or a blood gas on oxygen? In this case, we want to do a room air blood gas. When we do enter that, you notice the color has changed and it's green and it's happy. And then last of all, we're going to order a chest x-ray. So short form of CXR. We're going to order a 2-view down in the lab department, and same thing. We're going to not, it doesn't have to be urgent. It can be a routine x-ray, but it's still highlighted red, which means there's some mandatory information that it wants. And in this case, it's the relevant diagnosis. So we want to review. So the reason we're doing the x-ray is new pneumonia admission. Okay. Once we're happy with that, we're going to click submit. We can review our order. So we've ordered updated blood gas, another CBC from a couple of days ago, new lights, and an updated chest x-ray. Once we're satisfied with that, we're going to type in our PIN. And those orders have been filed. It's going to take a quick minute here and just go to our document section. So the premise is that we've now assessed the patient. We know better how their clinical status is, so we're going to document the findings of our note. So in this case, we're emulating, we said, a hospitalist. So I'm going to type up a hospitalist. We've got a couple of formatted notes, a consult and a progress note. In this case, it's a progress note. So in here, we're going to go straight to our narrative. And this is the important function in here. We want to make sure that if you're using DMO, and I'm going to do a quick showcase of that here, is you want to make sure that even though the cursor is blinking, it doesn't mean that it's necessarily active. If I click off screen, it's still blinking here, and this isn't the target. So you do have to make sure that we're blinking in here, and quite often you'll notice whichever application you're on. So in this case, it's a Chrome application. So when I click inside of this box, it does tell me I'm inside of this box here, and my text is correct. Using DMO, my sample. So as we're doing this, when I announce the text my sample, DMO recognized it, and now it's going to my mandatory fields. Cough, shortness of breath, and wheezing. Next field. Was ordered. Go to end. New line. My normal. New line. As well as auto entering text through DMO, you can also do straight dictation. Current complaint. The patient is 62-year-old. Undo that. The patient is a 66-year-old male with a history of mild COPD who complains of cough, shortness of breath, fatigue, fever, progressively worsening over the last week. He has a history of COPD which he believes to be mild, period. This is treated with a Ventolin puffer, comma, which he typically uses once or twice a week, period. So as you can see, we can do a combination of inserted text and free text to document our note. When we're happy with our note, we can press preview. It's all there. If we're happy with it, then we can save it. So currently it's in a draft form, but if we're happy with it, we can then sign the note. When we do sign it, we're provided with a prompt to say, do we want to send it to any other areas? So in this case, it's going to go under internal medicine because that's our specialty. So that's from a filing point of view. We're going to click sign. And our note has been signed. What I'm going to do is to go into our chart, provider notes, and there's our note will appear here very shortly. And there we go. So it's now been populated in the provider notes in the patient's chart. Thank you.